A vaccine gamble in Quebec that sparked criticism and questioning and debate among experts may in fact be paying off. Quebec decided to delay giving second doses of its vaccines for up to 90 days, a move to stretch out the supply, hoping the first shots would be effective for a longer period of time. Michael Serapio begins our coverage as we look at that. Michael, as I say, there was a lot of questioning of the strategy, but the early data suggests it was the good one.
Well, at first blush, absolutely, although we have to point out that not everybody is sharing in the enthusiasm. But as you say, the decision by Quebec in January to essentially delay first and second dose upwards of 90 days, well beyond the 21 days that was recommended by Pfizer-BioNTech, certainly raised a lot of eyebrows. But Quebec did make the argument, with so little supply available and much of it delayed in the first months of the year, it would be better to inoculate as many people as possible and give them some immunity. Also bearing in mind that Quebec really had been dealing with some of the biggest numbers of daily new cases in the country. Of course, the concern was, did going to 90 days compromise the effectiveness of the vaccine? Experts knew that after a time, just one dose provided some protection, but was it enough, and would it last? Well, there is, as you say, new data out. It comes to us from the Committee on Immunization for Quebec, and it does support the Quebec government's decision to go this route. Now, it looked at the early numbers from the province's inoculation campaign, and the data, they say, indicates with just one dose, the vaccines have been 80% effective after 14 days in younger people, primarily healthcare workers, and after 3 weeks among long-term care residents in the province who tended to be older and sicker. And there's no indication that the first dose immunity weakens over time. Take a listen to epidemiologist Dr. Gaston Dussel.
With the vaccine world, we know that vaccines do protect for long periods. And in general, if you're 90% protected with a first dose, this won't decline in a matter of weeks. It will last for months, if not years. The Quebec Immunization Committee is not saying that the second dose is not needed. It is maybe deferring the second dose later may give us a better chance to protect a larger number of people.
But as I said, not everyone is buying into this, concern that the numbers do not show the big picture because the conclusion is not measured against any control group, nor does it take into account other possible factors. Take a listen to Dr. André Veillette, who is an immunologist who sits on Canada's COVID-19 task force.
This is not very convincing. It's very hard to know if the decrease that we saw in people who were vaccinated was due to the vaccine or was simply due to the fact that the number of cases in the general population was going down.
Now, another factor to consider, Heather, are the new variants. There is no data that supports the effectiveness of a first-only dose vaccine against these new variants, but certainly these new numbers give officials something to ponder as they look at a way forward in terms of inoculating as many Canadians as possible, Heather.
You know, this continues to be a big issue, Michael, and I was noting yesterday, we were carrying live the public health briefing yesterday, and Dr. Howard New, who's the Deputy Chief Public Health Officer, was echoing the Quebec numbers, saying that early data, in his view, does indicate a good level of protection after just one dose. So he's also saying that. New Brunswick, obviously looking at similar findings, it too is deciding to delay what it's doing now.
That's right. That news essentially announced yesterday as New Brunswick was talking about who would be getting the next doses of vaccine between April and June. They were talking about people over the age of 70, those who had complex medical conditions, people who live in shelters. And in that same news conference, the province's chief medical officer said, with variants circulating and studies that show a single dose can give good protection, well, New Brunswick will be guided by the principle of getting as many first doses to people as possible by delaying second doses in some. Now, that does not mean that everyone's second dose will be delayed, but it gives the province more flexibility, which goes to show with the vaccine supply limited, Heather, and these studies and these data is now coming out, certainly health officials have more to consider than they did just even a few months ago as to a way forward when it comes to vaccines.
Michael, thank you very much. Beginning there with Michael Serapio this morning.